Hey guys, I'm Charlotte Moore.
And I'm Christina Denny. Welcome to our first Facebook Live with GBMC Healthcare.
Oh my gosh, we are very excited. This is the first of many where we're bringing you important information to stay healthy all year round. And we want you guys to be a part of this very important conversation. Right,
Yes,
Christina?
we do. Please ask us any questions that you might have. Just comment below during this Facebook Live.
Woohoo!
Today, we're talking about protecting our skin, especially throughout the summer.
Yes.
We're getting some expert advice from Dr. Kevin Ferentz from the Department of Family Medicine at GBMC Healthcare. Thanks for being with us.
Thank you for being here, doctor. We're so excited to have this conversation. Let's talk about skin cancer. What exactly is skin cancer?
Well, skin cancer, like every other cancer, is where the cells just start going crazy.
Yeah.
And they start multiplying over and over and over again, and they behave inappropriately. And you have different kinds of skin cancer.
Mm-hmm.
The common skin cancers are basal cell carcinomas and squamous cell carcinomas.
Okay.
And then we have the really lethal skin cancer, which is called melanoma, which are the darker things that usually start in a mole or look like a mole, but they're actually melanoma.
So from your descriptions, am I correct to assume that melanoma is the most dangerous type of skin cancer?
Without question, there are about 500,000 cases of skin cancer in America every year diagnosed, and there are many, many other cases that never get diagnosed. And in the case of melanoma, 10,000 people die every year of melanoma in the United States.
Oh my gosh, and that's just one of the types of skin cancer?
Yeah.
Correct.
Wow.
And obviously this is the most dangerous one as well.
Yeah, it's really the only kind of skin cancer that kills you. Luckily, squamous cell and basal cell carcinomas, they don't spread. They don't spread to other organs, what we call metastasis. What they do is they just get bigger and bigger at the site where the cancer starts.
Gotcha.
So they start off as a tiny little lesion. They can become a large basal cell and a large squamous cell, but they won't break off and go to other organs, which is ultimately what kills you, and melanoma does do that.
Sure. Are there particular parts of your body that you tend to see skin cancer more? Like, I know a lot of people probably get burned on their shoulders, or maybe the tops of their ears.
So any place where you get sunburned or sun exposed, you are likely to get a skin cancer. Since most of us wear bathing suits when we're outside, we don't usually see skin cancers in your private parts. But
That's good.
You can see them anywhere on the face, on the ears, on your neck, on your back, back of your legs, feet. It can occur anywhere.
Yeah,
Oh,
and
wow.
sunscreen is so important. Can sunscreen actually prevent skin cancer?
They can. So let's talk about the kinds of sunscreen. So
Okay.
we basically have two different kinds of sunscreen. One kind has a chemical in it, and there's a whole bunch of these chemicals that take the dangerous rays of the sun and they diffuse it. They make it into heat on your skin. And actually sometimes people will say that their skin feels warmer after they put a sunscreen on, and that's very true.
That's interesting.
The other kind of sunscreen just blocks the rays altogether, and that's stuff like zinc oxide. It's this really thick white stuff that people will put on. No one likes using zinc oxide.
Is that the one that smells kind of funny?
It also smells kind of funny. In the old days, this is like in the movies, you'll sometimes see the lifeguard at the pool
With the nose.
who has the nose with the white stuff. Okay,
Classic.
that's zinc oxide.
Gotcha.
Nobody likes to use zinc oxide, but it is a very effective sunblock as well. So yes, the answer is that sunscreen does prevent skin cancer, and it's critically important that in the summertime especially, people wear sunscreen every day.
And
Yes,
we should
everyone.
and we should all wear sunscreen.
Yes.
That's so important because a lot of times, African Americans or people with darker skin are a little bit hesitant to wear sunscreen, and we need to change that conversation.
Yeah, I think it's because African American folks and people with darker skin think, oh, well, I can't possibly get skin cancer. So it's true, there's less skin cancer in African American patients and in African American people and people with darker skin, but it does happen. But it's not just the skin cancer that sun rays cause. It also causes your skin to wrinkle. It causes your skin to dry out. And it also causes darker patches on your skin. So cosmetically, you don't look as well when you've been exposed to the sun.
Yeah, we wouldn't want that.
Yeah, no one wants uneven skin or wrinkles. We want to look youthful.
Look and feel our best.
There you go.
So if there's a mole that we're kind of iffy about, is that something that we should take to our PCP, or do we go straight to a dermatologist?
Well, of course, as a family physician and a primary care provider, I would say that you should always bring that stuff to me for me to take a look at it first. In actuality, many family physicians actually do the procedure that would be required if they think you have a skin cancer. We can actually do a biopsy. We may be able to freeze the lesion with liquid nitrogen or apply a chemical to it to try to get rid of the cancer, or what may be a precancerous lesion. So I would say go see your family doc first, and then if the family doc doesn't know what it is or doesn't have the ability to handle it, they'll be happy to send you to a dermatologist.
If somebody's nervous about, having a biopsy done, could you just talk us through how that procedure works? It's not as scary as it sounds, right?
So it is a completely painless, truly. The only part of a biopsy that's uncomfortable is the local anesthetic. And I've done thousands of skin biopsies in my career. Afterwards, everyone always says, well, that really wasn't that bad.
You're like, oh, you're finished?
Yeah, and truly, you are numb when it's done. And there are two ways that we do it. One is with a scalpel blade, and we actually take a larger, what's called an elliptical incision. And the other kind is that it's actually this little round, little circular scalpel, and we do what's called a punch biopsy, where we just go right in, take it out, snip the lesion off, and usually put a stitch in. Very simple.
Sounds easy.
Gotcha.
Nothing to worry about.
Right? How about like flat moles or even like beauty marks? Do we have to be mindful of those as well?
So only if the mole changes, right? If it's truly a beauty mark on your face and it's been that way forever, it's not going to become a skin cancer.
Okay.
But moles change when they become skin cancer, when they become melanoma. And there are 5 things that we talk about. It's the ABCDE of melanoma.
That's easy to remember.
So A is asymmetry. Right? If you have a mole that's perfectly circular, less likely to be melanoma. A melanoma is asymmetric. It's the shape of it is not symmetrical. Okay, you can't cut it in half and it looks the same on both sides. B is the border, and it's the border of the color. If you have a mole and the color in the mole is sort of leaching past the edge of the mole, that's a suspicious thing. C is the color, right? A non-malignant mole, a benign mole, usually has the same color.
Yeah.
It's uniform in the color. D is diameter. How wide is it? So most of the time, if it's less than 6 millimeters or less, and how big is 6 millimeters? It's a pencil eraser.
Yes.
Okay, so if you have a mole that is bigger than a pencil eraser, that's something that you would want to talk to your doctor about. And the last thing is evolution. Is it changing, right? A mole that's benign doesn't change. But if it's getting bigger, the color has changed, it was flat, now it's raised, it's starting to peel, and it was never doing that before, that's something that your doctor needs to take a look at.
Okay.
Good
These
to
are
keep in
very
mind.
important tips.
It is. And Laura sent in a question. What are signs that a spot on your skin is cancer and not just a mole? So she wants to pay attention to those ABCDEs.
Laura, that is exactly the deal. ABCDE. If it is a symmetrical spot that's been there for 20 years and the color is uniform and the color is not going past the bump that's there and it hasn't changed, it's very unlikely that it's a skin cancer.
Okay,
When in
good
doubt,
to know.
though, just check with your PCP. They're going to let you know one way or the other.
Correct.
Okay, so
good.
melanoma. What are
Yes.
some of the symptoms we need to know?
So unfortunately, melanoma, sometimes the only symptom is the mole has gotten bigger or the mole has, it was flat, now it's raised. Or now the good thing about melanoma and catching melanoma, and this is why the 6 millimeter thing is important, melanomas go through 2 stages of growth. The first stage is what we call horizontal. It gets wider and wider and wider. The second stage is the more dangerous stage, and that's the vertical stage, and that's when it starts to dig deeper into your skin. If you catch the melanoma when it's in the horizontal stage, usually less than 6 millimeters in size, the likelihood is you're going to take it off and you're cured. It's only when it's been sitting there for years and gotten deeper that that's where you have more of a problem, where you need to take a larger amount of skin off. You have to go deeper into the skin, and unfortunately you may need to have various chemotherapy kinds of treatments for it as well.
So guys, any signs, go see a doctor.
For real.
Really.
Is melanoma hereditary?
So what is hereditary are what are called atypical nevi. And atypical, nevi is the $50 word for a mole, right? And atypical means it's just not normal. It looks a little weird. So there are many people that have families where you have multiple atypical nevi. Those, unfortunately, are the ones that are more likely. They don't all become melanomas, but they're more likely to become melanomas. So if there is a family history of atypical nevi, those people have to be watched carefully to make sure that none of them are progressing into being melanomas.
Yeah.
And it says up on your screen now that the risk for melanoma actually doubles after you've had more than 5 sunburns. How serious of a sunburn are we talking here? Like any sunburn?
Any sunburn. And if you get red and it hurts and you've had a sunburn, you get 5 of those, you have at least double the chance of developing a melanoma.
Oh, I hope I'm okay. I've definitely had more than 5 sunburns in my lifetime.
Oh my goodness.
No
Even just
more.
this summer, I've had a couple.
Right, so, and the real problem is that when you're young, it's not an issue. But even without melanomas, forget about melanoma.
Yeah.
It's all skin cancers are increased with each time you get a sunburn. So down the road, unfortunately, because of the sunburns that you've had, you're going to have to be careful to look out for basal cell carcinomas and squamous cell carcinomas as well.
Good to know. This is
that in
great
mind.
information. And we actually have another question coming up from Mindy. So what if a mole suddenly has a dark spot in the center? What can we do, doctor?
So Mindy, that's something that you need to have checked out by your doctor. You need to look at it because when a mole changes, that's one of the indications that it may be melanoma. I don't want to scare her. Right? You can sometimes have a mole change, and it's certainly not melanoma, but it's pretty easy to take a mole off. Cosmetically, it's usually not that big a deal. You'll be left with a line of a scar where the mole was, but more important to get the mole off if there's been a change.
Definitely.
So let's talk SPF. What number offers the best protection?
So first, let me tell you which number doesn't offer you
Doesn't.
protection.
Okay.
We need it out.
That's 15 or less.
Really?
All right, don't do it.
Yeah, nobody should use
15
15s or
before.
less.
I feel bad now.
It's not helping you. 15s or less are just not helping. They tend not to block both UVA and UVB because you have to block both of them. So what's SPF? It's sun protective factor. So if you would normally burn after a half hour in the sun, 30 minutes, if you wear an SPF 30, it means it's 30 times as much time before you would burn. So that would be 15 hours instead of 30 minutes.
Did not know that.
So most of the recommendations are to wear at least an SPF 30. Probably an SPF 50 and beyond SPF 50, it's sort of overkill because that's like 25 hours. You know? So what's the chance that that's going to happen? Now, but if you're the kind of person who burns in 5 minutes, then actually an SPF 50 might be a good thing for to use. Gotcha. Anything beyond 50 is unnecessary.
So how often should we actually like reapply our sunscreen?
Yeah.
So the simple answer is every 2 hours. There is no such thing as a waterproof sunscreen. So anytime you go into the water, you should also reapply your sunscreen. And then there are obviously different kinds of sunscreens. You have lotions, you have creams, and you have sprays. So the creams and the lotions definitely have to be on every 2 hours. You have to reapply every 2 hours. The spray has a couple of other issues. First of all, you don't want to use the spray on your face because we don't really know if there are any dangerous effects from inhaling the sunscreen.
So even if we hold our breath still, just avoid it. Just don't even risk it.
I guess if you held your breath, maybe you'd be okay. But if there's a cloud around you from the spray, it's probably better to use creams and lotions
Makes
on your
sense.
face.
Okay.
Then if you're going to use a spray, and a lot of people do like to use sprays, they're a little bit more convenient, you actually have to spray a couple of times because it's actually very easy to miss certain areas with just the spray. And after you spray, you want to rub the spray into your skin. Don't just let it dry out, rub it on.
Okay.
You
We're not
recommend-
spraying and walking away.
Exactly. Is there certain form that you recommend more than often?
Yeah, is one more effective?
So I would say because of the issue of spray, a lot of people will just do a quick psh, 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 and they think that they're covered.
Yeah.
I think creams and lotions are probably the better way to go.
Okay.
Every 2 hours.
Every 2 hours.
Or even more frequently, just to be safe.
You can. You can.
So we do have a couple of questions coming in. Our question right now is from Jimmy. So we're talking rosacea. What is the best way to keep it calm or even get rid of it?
Well, rosacea is a chronic skin problem that sort of looks like acne. And there are a whole bunch of different medications that you can use to treat rosacea. Staying out of the sun is very important with people with rosacea as well, but that's certainly, Jimmy, you should talk to your family physician, or if that person's not comfortable doing it, a dermatologist treats rosacea all day, every day.
Especially important to wear sunblock if you have a condition like rosacea, though?
Without question.
Yeah.
Acne, rosacea, any chronic skin condition, you still have to cover with sunscreen.
And for those people who don't know, what exactly is rosacea?
It's a chronic skin inflammation that looks like acne. If you didn't know it was acne, some people think that it looks like acne. It often occurs along the cheeks. It looks very red, very angry looking, but luckily it's very treatable.
Oh, that's good.
Good to know. We have another question as well.
Yes, from
This one is
Jessica.
from Jessica. So what types of sunscreen are best for people with sensitive skin? Good question,
Ooh,
Jess.
yes.
So I would say that all of the chemicals that we've looked at that are in sunscreen are all FDA approved. It really becomes a matter of personal choice which sunscreen people want to use. Some of them will say that this is specifically for sensitive skin. That's the mixture of what the chemical is in. Now, I don't care which kind of sunscreen you use, as long as it's an SPF 30. There's no one that's any better than another. Just keep trying one out until you find the one that you like.
Okay.
That is
Sometimes
good
when I put on
advice.
sunscreen, I feel like I look ashy. I have like this gray or white undertone.
You can still kind of see it even after you
Is
rub
there
it in.
like certain types of sunscreen for darker skin?
So I would not be surprised
Okay.
if there is not a sunscreen for African American patients and
man.
for darker skin. I don't have the name of it for you, but I would
Yeah.
not be surprised.
Okay.
given that
So we
it's
just need to just
America.
rub it in.
Indeed, but it
Okay.
still may leave a little bit of a white because it's a white cream, so
Yeah.
it may still be a little bit white on
Well,
there.
your health is your best
Yeah,
investment.
you know you're being
so
protected at that
yeah.
point, I guess.
Gotta do what you gotta do, guys.
Safety first, right? And we
Got
have
another
another question from Shelly. Are spray sunscreens equally as effective as creams?
Okay, good question, Shelley. It's all about using the spray effectively. If you want to use a spray, and I totally understand that that seems to be the most convenient for a lot of people, just make sure that you're putting it on a couple of different times, right? Go over it a number of times, 2 to 3 times, and then rub the spray into your skin to make sure it will work the most effectively.
Nice. We have another question from Shelly. Is there a difference between generic and brand sunscreen?
So
Slow
probably price, that I would imagine, that'll probably be the biggest one. So as long as the chemical that's in there is the same, it really doesn't matter if it's a branded name or a generic.
Go store brand, save some cash.
Yeah.
So say we did not do our due diligence, we got sunburn, say it's even a pretty bad sunburn. What do we do? How do we treat it?
Okay, so there's basically 2 levels of sunburn. The first is where your skin just gets red, and that can be treated with cool compresses, even ice. You can use one of those ice packs that you put in the freezer when you have a sprained ankle. You could use that. Try to stay hydrated. Use any over-the-counter pain medication that you would normally like to use, like Tylenol or Aleve or Advil. And then you can use 1% hydrocortisone cream. That'll decrease the inflammation. And you want to keep your skin moist. So you'd like to use a moisturizer as well, not Vaseline, not a grease, but actually a cream would be better.
Gotcha. And aloe vera is a good option?
Aloe vera would be perfectly fine as well.
Classic.
All right. I have noted from experience, though, don't use a scented lotion. The alcohol in it burns.
I think you're absolutely right. Plus, it also dries your skin out more.
We do
The
not want
alcohol
that.
will dry your skin out more.
That's the opposite of what
Then
we're
you have the
looking
next
for.
level of sunburn, which is where you have blisters. That's a second-degree burn. So that's a much more significant event.
Right.
If there's only a couple of them, you could still do all of the other stuff. You could ice it down, and you could do the 1% hydrocortisone. But if you have multiple blisters, or if they're big, you should probably go see your family physician, and we can help you with that. Because sometimes sometimes you will develop infection.
Yeah.
And you are much more likely to get infected if you pop the blisters. So when you have the blisters, don't pop the blisters. Keep them protected, keep them covered, but don't pop them.
Good to know. I know it's tempting, guys. Don't do it.
So do we treat children, let's say, who have, had a sunburn differently from an adult? How does that?
Not typically.
Okay.
I mean, but the important thing for kids, because their skin is so sensitive,
Very.
little kids' skins are so sensitive, that we usually don't recommend kids to use sunscreen until they're about 6 months old.
Okay.
Okay.
Under 6 months old, the most important thing is to not expose your child to the sun. You need to keep your kid in the shade. They need to wear a hat.
One of those cute big ones.
Preferably a hat with a brim. I was just going to go there. When you're in a stroller, you should you should make sure that the roof of the stroller is out. And then after 6 months old, you can certainly apply sunscreen to little kids.
Gotcha. So speaking of young people, I know even when I was younger, even if I applied sunblock, I was still, getting tan throughout the summer. Does that increase the risk of, any negative effects, even if they are using sunblock, but their skin's still getting darker over the summer?
So I would say that as long as they're not burning, it's probably not going to be a problem for skin cancer. But even tanning will increase your risk down the road of wrinkling, of having that thick, leathery kind of skin,
Yeah, we don't want that.
when you get older, and you don't want to do that. So I would still say if you're getting really tan, it means you're not wearing enough sunscreen.
Speaking of tanning, can you please talk about the dangers of tanning? Because, it still hasn't registered to so many people's brains right now.
It's such a funny thing. There was such a long history in human history where for Caucasian people, having the whitest skin you could possibly have was like, that was beauty. And now it's having tanning. Tanning booths are terrible things.
Terrible.
Okay? They cause skin cancer, plain and simple. They cause skin cancer. They cause wrinkling. They cause that thick, leathery kind of skin that people get when they're old. And so no one should ever go into a tanning booth.
Thank you, doctor.
Just don't do it. Get a spray tan. There are so many fake tanning options
Foundation.
nowadays.
Come on, guys. Seriously.
Like, just as many options as sunscreen, we have the fake tanning options as well. We got the sprays and the creams and the lotions.
Keep your health with wealth, please.
Plus, be proud of your
Yes.
skin. It's a
Okay,
detail.
guys. We have another question coming up from Susan. So how do you know when a sunburn is sun poisoning?
Ooh,
Very good
yeah.
question, Susan. Thanks for that.
So with sun poisoning, you're sick, right?
Ah.
You're ill. It's not just a localized inflammation on your skin, but you may actually throw up. You may feel really fatigued, like you have to go to sleep. You may lose your appetite. You may feel incredibly dry. And so with sun poisoning, you do want to go see your doctor to make sure that you're okay. The worst is heat stroke. And heat stroke is where you actually get neurological symptoms, just like a person who is having a stroke. And you can lose consciousness, and you can have other neurological problems. You may not be able to speak well.
Oh, wow.
Yeah, so those are, and if you have the potential for heat stroke, you actually need to go to the emergency room.
Gotcha.
That's a medical emergency.
Yeah, it sounds like it. How important is hydration throughout the summer in relation to, our skin and getting sunburned?
So it's an important thing. I'm not an 8 glass of water a day person.
Really?
Yeah. So where that really comes from is we are supposed to take in 2 liters of fluid a day. That's 8 glasses. But 90% of the food that we eat is actually water. If you take your food and crush it, a lot of water comes out. So actually, I'm a big believer in drinking when you're thirsty.
Gotcha.
And in the summertime, when you're outside and it's hot, you may get thirsty. And so,
Yeah.
yes, you should be drinking water, but you don't have to force yourself to drink water if you're not thirsty.
Okay, that is good advice, because I know a lot of people out there are forcing themselves to try to get that gallon a day down. It's okay, just drink when you're thirsty.
Baby steps.
So let's go back to sunburn and some healing methods. I know there's a lot of over-the-counter things that we can buy. Are those effective, or should we stick with the tips that you gave us?
So I think a lot of the over-the-counter stuff that's there is the stuff that I talked about.
Yeah.
It's
Yeah.
got 1% hydrocortisone in it, and that's an anti-inflammatory. It will have a moisturizer in it, so that'll keep your skin moist while you're recovering from the sunburn. So I think the over-the-counter products are fine.
Good to know.
Nice.
So
And we have a question coming up.
Who is
Let's
this one
see.
from? Give us just a sec. All right, Harry. Hey, Harry.
Okay. Is zinc-based sunscreen good to use?
So a zinc-based
Zinc.
sunscreen.
Oh,
so that's okay. So just like we talked before
Yep, with the
about
nose.
zinc oxide, so that's zinc oxide, and there are other sun blocks. Those are called sun blocks, not sunscreens. And yes, they're perfectly fine to use. It's just you walk around looking kind of weird. You know, if you're covering your entire face with it, it would be a problem. But no, zinc oxide is perfectly wonderful to use as a sunblock.
So you'll be safe, Harry, but you might get some looks.
Hey, do what works for you, Harry. We're all
There you
about
go.
that here on
You're
BMORE
protecting your
Lifestyle.
skin. That's what matters.
And doctor, let's talk about your journey a bit. You have a
Yeah.
connection with this as well, right?
Yeah, I do. So when I was graduating medical school many years ago,
Still look good, doc.
oh, thanks so much. I had a mole on my back that changed, and it got bigger, and it started to like scab over, and I showed it to the dermatologist who I was rotating with on my dermatology rotation in my third year of medical school, my fourth year of medical school, and he said, you know, we should probably take that off. And it turned out I had a thin melanoma.
Oh, wow.
So this was in 1983. Things were a little bit different in 1983. I had a much larger excision of my skin than I needed to have. Nowadays, it's actually just a simple excision. You just take it off. I had to have a big chunk of skin taken off out of my shoulder. But thank God it's been 35 years later, and I haven't had a recurrence. But I will tell you, I have had many other skin damage issues in my life because there was no such thing as sunscreen when I was growing up. It did not exist.
Is that right? I didn't even know that.
All there was zinc oxide, and who would ever possibly walk around with zinc oxide on? And so I unfortunately have gone on to have a basal cell carcinoma and a squamous cell carcinoma. I have other skin damage called actinic keratoses, which you have to take off because they become squamous cell carcinomas. So unfortunately, I grew up in a time when there was no real way to block the sun other than wear a hat, and you know, that looked sort of silly. So, so I'm very well acquainted with the issues of skin cancer, and very fortunate that my melanoma was caught very early.
Well, thanks God that we're having this conversation
Yeah,
and
really.
bringing this open flow of communication because people need this information.
They definitely do. And we have another question. This is a question from Shelly. Hey, Shelly. So a sunburn with swelling and inflammation is not necessarily sun poisoning, right?
That's correct, Shelley. It's not. It just means you've had a second-degree burn. That's what causes the blisters. By definition, a second-degree burn is a blistering burn. And but it's not sun poisoning. That's usually a much more, if you had blisters in a whole bunch of different places, that could very well lead to sun poisoning, where you'd feel ill. But with just some blisters, that's just a second-degree sunburn.
Okay.
Gotcha. There you
So
go,
the
Shelley.
weather, this is the time of the year. Everybody wants to go to the beach, spending time outside, outdoors. What are some tips to stay nice and protected?
So make sure that you're wearing sunscreen. Try to stay out of the sun. We didn't talk about this before, but actually try to stay out of the sun completely when the sun has its most dangerous rays, and that's from about 11 o'clock in the morning till 3 o'clock in the afternoon. If you want to go outside, go early, go late, much less likely to get burned if that happens, if you go out then. Make sure you're applying sunscreen. Make sure you're applying it at least every 2 hours. If you're using sunscreen that is a spray, make sure you're applying it multiple times and then rub the sunscreen into your skin. Wear a hat with a broad brim on it to protect you. If you're at the beach, go under an umbrella. So you, and if you go into the water, there is no sunscreen that is waterproof.
Man.
So as soon as you get out of the water, put your sunscreen on again. Use at least a 30 SPF sunscreen.
Good to know. So is it true that UVA and UVB rays can both get through clothing? We can still get burnt through our clothing?
Absolutely. You can get sunburned through your clothing, especially if you're wearing
man.
summer kind of clothing where it's very light and there are little holes in between the, in the cloth.
Is that the same for car windows?
It is. You can get
Darn
sunburned
it.
through a car window. You
I
have
didn't know
really,
that.
you
I'm
learned
on
a
it.
lot
Christina,
about
you're
this
on it.
stuff. Good for you.
Well, I'm
can.
pretty light-skinned, so I get burned easily. So with your experience, do you have any advice that you give to patients as far as like preventative measures or just some advice for them if they are dealing with this?
So I would say that don't be afraid to go to the doctor if you have a skin lesion that looks like it's different, it's new, it's changed. you know, when you have the precancerous kind of things like these actinic keratoses, I freeze them off in my office all the time, and then you actually prevented yourself from ever getting skin cancer. If you have a small basal cell carcinoma, that can be taken care of very easily. And similarly with a melanoma, people don't have to die of melanoma. If you have a change in a mole, go to your doctor. Let us take a look at it and maybe take it off.
So the good news is once detected early, if treated, we're pretty much good.
Absolutely. For all of our types of skin cancers.
That's good to know.
That's great. We have another question.
From
This is from
Courtney.
Courtney. Hey, Courtney. Should we worry about new moles or freckles after sun exposure, especially as people of color?
So I would say freckling in and of itself is not a dangerous thing, right? All a freckle is the normal pigment that we have in our skin is instead of it being uniformly in our skin, there's little pockets of it, and that's a freckle, and I had 80 million freckles when I was a little kid. So freckling in and of itself is not a problem. If a new mole develops after sun exposure, whether you are darker skinned or lighter skinned, if it persists, if it's still there after the sun exposure, that should be evaluated.
Oh, interesting. Do we see, I mean, obviously my freckles come and go based on the season, but is that a typical thing that we see, you know, spots popping up and then they just go away?
Right, so the problem is in lighter skinned people who get freckles, that means that the melanin, which is the chemical that's in our skin that's supposed to diffuse the rays of the sun, isn't working in us. And that's why lighter skinned people are more likely to get skin cancer, because our melanin is not dispersed uniformly in our skin. It's in little areas where we get these freckles.
Okay.
Interesting.
So can you use bug spray and sunscreen at the same time?
You can.
Okay.
You can if you'd like to.
And there's even sunscreen now that has the bug repellent just
Yeah.
built in with it. Is that as effective as, you know, just a plain sunscreen?
As long as it says SPF 30 or SPF 50 on it, it doesn't matter what else is in there. It means that they have said that this is the effective amount of sunscreen, and whatever things else is in it, whether it's moisturizer or bug repellent or fragrance, at least, as long as it's at least an SPF 30, you'll be okay.
I know some makeup products have sunscreen in it. So do you actually have to put your sunscreen on first and then put your, let's say, your moisturizer that has sunscreen in it as well? Or we can just stick to one thing?
If the moisturizer has it, to my knowledge, and I don't wear a moisturizer, but to my knowledge, I think the moisturizers usually don't have very high SPFs in them.
Yeah,
I
it
think
might be
they're
like
more like
15,
5s,
30.
10s, 15s. Those are not going to be enough to protect your skin. It's additive. And so actually it really doesn't matter whether you put the moisturizer on first or the sunscreen on first, as long as it's at least a 30.
Okay.
And this just popped into my head. I know this is not your area of expertise necessarily, but there are also sunscreens that are tinted, like a skin color.
Yeah, like
Would
a
that
foundation.
affect the effectiveness, or is it the same? It's just as long as it has your
As long as
sunscreen,
it
you're
says,
good.
so the nice thing about sunscreen is these are FDA approved products, which means it's been tested, and if there's tint in it, it doesn't matter.
Awesome. There you go. You can
That's
have
a
your
little
skin look
beauty
nice
tips.
and protect it.
How about wintertime? You still need to wear sunscreen, right?
Well, we should actually, because the damaging rays of the sun are out. Actually, as long as the sun is out, there's damaging rays of the sun out. So if you're going to be outside a lot, I used to ski, and if you skied in the middle of the day, you absolutely had to wear sunscreen. You would get sunburn in the middle of the winter.
You hear it,
Right.
guys? See?
Or
Always
even
need
if
to
it
wear
is
sunscreen.
summer. I know it's been like raining for the past month and it's been dark and cloudy. Still wear sunscreen even then?
Yes, during the day, you could, anytime you are out during the day, even when it's cloudy, the rays of their
Really?
sun are coming through. Yeah, the
never knew
ultraviolet
that.
rays go through clouds.
They
So
go through
basically,
everything,
anytime
guys.
you're outside, you need to wear some sunscreen.
Just do it every day.
Yeah, if you don't want to get skin cancer and you don't want to get your skin to wrinkle, yes, you should be wearing a sunscreen.
So apart from wearing sunscreen, are there any other habits that we can have just to, you know, keep our skin nice, stay hydrated, wear sunscreen?
Yeah, I would say that, you know, make sure you're not wearing a makeup for women that's irritating your skin. That would be a good thing. I mean, I'm not a cosmetologist, but other than that, keeping hydrated, using a soap that's moisturizing as opposed to drying. If your skin does dry out, using a moisturizer, not a grease, not an oil-based product like Vaseline, but a water-based cream, like things like Eucerin and Lubriderm. Those are usually good protective kinds of things for your skin.
Good to know.
Keeping us looking youthful.
Right? We have one more question Renee, so what kind of sunscreen is the best?
Well,
Haven't talked about
I don't
this,
have
but-
any stock in any sunscreen company. So what I would say is use whatever sunscreen that you like. There's any number of different kinds.
Got a lot of
And
options on our
yeah,
table
a
right
lot of
here.
options, and this is only a small smattering of the
Yeah.
number of sunscreens that are out there. As long use the one that you like and have it at least be an SPF 30.
Very, very good. Well, we've gotten so much ground covered in today's conversation. Is there anything that you need to get out there for our viewers before we wrap up?
No, just make sure you protect your skin.
Yeah.
It's something we don't. The skin is the largest organ in our body, and
You
any
don't
place.
even think about that, doctor.
You're absolutely correct. And anytime you have a lesion that you suspect is new or has changed, make sure you show your doctor.
Yep.
Oh, I just have one more question. Just popped into my head. Can we get skin cancer on our eye?
In your eye,
Does that happen ever in that area?
so actually you can.
Wow.
There are melanomas of your retina.
Wow.
Yeah.
And is that from the sun or?
It is. It's from the sun.
So we have to wear our
exposure.
shades.
That's correct. We didn't actually talk about that, but
yeah.
wearing sunglasses is also important to protect the retina from sun damage.
And-
Good question.
Yeah, I know. Well, I was just thinking as I was looking at
Because
you.
it makes sense if you think about
Right,
it. You know what I
that's-
mean? And that's why
and
people wear
exposed.
sunglasses.
Place also, yeah, and I know a lot of them do have the little stickers that say blocks UVA,
Yeah.
UVB. So I guess that would be important to look out for.
Indeed, yes. When you have a melanoma, you have to go see an eye doctor to make sure that you don't have any melanomas in your retina.
Oh wow.
Okay, well, thank you so much, doctor. I've learned so much. Christina, we
I
have
did
to wear
as well.
sunscreen every single day.
Sunscreen, sunglasses.
Protect
All of
yourself,
it,
protect
yes.
your health, protect your beauty.
Yep.
Yep. And thank you guys for joining us in this
Yeah,
important
thanks for tuning
conversation.
in. Thank
We
you
have
for
a lot
sending
of
your
good stuff, and of
questions.
course,
Thank
gotta
you,
thank the
doctor.
boss right here.
My pleasure.
Great chat. Thanks for being with us.